Good morning, and now we are starting our first presentation, that is on surveillance. My name is Manzoor Hussain, and during this presentation, I will briefly discuss how we succeeded in improving surveillance system, particularly for FMD in a country like Pakistan, where the disease is endemic, and we did not have a real situation of the disease, and that what is the pattern of FMD in Pakistan. FMD is the most important and most prevalent disease in Pakistan, and the surveillance system basically it moves with the help of field veterinary staff, and all the reported outbreaks they are submitted to the district livestock officer on monthly basis, and then all this information is gathered at the central level in each province. And in each month, all the information then it is submitted to the chief veterinary officer on monthly basis. And before we started improving the surveillance system, on only 30 to 50 outbreaks of FMD they were reported annually, and unfortunately there was no SOP available with the field veterinary staff how to handle FMD outbreak. If you look at the infrastructure of veterinary service in Pakistan, you can see that we have veterinary hospitals about 1,000 throughout Pakistan, and then we have veterinary dispensaries more than 3,100, veterinary centers 3,700, and then we have mobile dispensaries 141 and diagnostic labs 82. Here all the field veterinary staff it is helping livestock farmers for controlling the disease. In spite of this well-established infrastructure, the surveillance system was underperforming, and that was one of the reasons that we started working on developing a surveillance model. And this surveillance model was developed under FAO project, Progressive Control of FMD in Pakistan, and it has the main elements, 6 elements. If we really want to implement successfully this surveillance model, then there are 6 important essential elements that we need to address. The first one is that the stakeholders should be aware of the FMD, its significance and its economic impact. And the main force, that is the field veterinary staff, it should be well trained how to handle an outbreak of FMD. And at the same time, the trained staff should have a sample collection kit to use it while attending FMD outbreaks. It is also very important that the expenditures incurred for collection and dispatch of samples to the diagnostic lab, it should be also supported. It's not only enough to report the disease, it's also very important that while reporting the disease, there should be a responded back, and there should be control activities to minimize the spread of the virus or to contain the infection. And the last element is that all the laboratory information or laboratory results of the sample submitted should be shared with the field staff who submitted these samples. This is the diagrammatic representation of the surveillance model for FMD. You can see that on the top there is a field veterinarian who is the main force in improving the surveillance system, and it's collecting the samples, submitting to the diagnostic lab. And you will also see the provincial TAD officer. TAD officer is an important person designated by each livestock department in the country, and it facilitates implementation of project activities in its own province. And all the information of lab results and outbreak reports, basically it gathers, it is submitted to the epidemiology node at central level, where a trained epidemiologist collects all the information and analyzes the data. Now, to address the elements of this surveillance model, first of all, we organized awareness seminars for the farmers, which are a very strong stakeholder in this whole system. And in the whole country, we organized 143 awareness seminars, and about 6,000 farmers, they attended these meetings. And these awareness seminars, trained with the help of the local veterinary staff, the farmers basically they were trained, they were educated in the area of disease prevention and control. At the same time, they were informed that what are the advantages of reporting an FMD outbreak and what advantage they will get if they will report the disease to the nearest veterinary hospital. The next activity that we carried out was basically to building the capacity of the field veterinary staff. And we organized training workshop, about 80 training workshops throughout Pakistan. And we trained more than 2,400 field veterinarians. And during this training workshop, which was 2 days long, we trained them in the areas of disease diagnosis, FMD vaccines and vaccination, sample collection, storage and transportation. And then we had the area where we provided training that was biosecurity and treatment. And lastly, about the basic concept of epidemiology for controlling the disease. And that was basically this how we addressed these 6 elements of this whole surveillance model. And as earlier mentioned that before we started implementation of this surveillance model, only 30 to 50 FMD outbreaks they were reported annually. And immediately after implementation of the surveillance model, during first year in 2012, we had information from 1,088 FMD outbreaks. And you can see that there's a huge improvement in the surveillance system. All 3 serotypes of FMD virus OA Asia 1, they were present throughout Pakistan, as you can see from this map. And during the next year, that was 2013, again when most of the staff was trained, and you can see that more than 2,800 outbreaks they were attended by the trained field staff in the country, and all the information it was gathered by the epidemiology node at central level and analyzed. And these during 2013, most of these outbreaks they were shared between O and A serotypes. But next year, when we see that this was again the spatial distribution of FMD outbreaks during 2012, 13, and during 2014. Situation was almost the same, that more than 2,800 outbreaks, they were handled by the field veterinary staff. But this time, most of the outbreak, it occurred due to O serotypes. And this is the spatial distribution of FMD outbreak due to 2014. You can see that wherever there is population of cattle and buffaloes in Pakistan, where we had the outbreak of FMD reported and handled by the field veterinarians. And this is the situation in 2015. Now you can see the decline in the number of outbreaks reported, 1,055 instead of more than 2,800. And we believe that this was basically the impact of the implementation of the field, our surveillance model. Most of the veterinarians, they were attending the outbreak, they were implementing activities to contain the infection. It helped in spread of the disease or the virus in controlling FMD virus. And now the next, this is spatial distribution of FMD outbreaks during 2015. And during the first quarter of 2016, 531 outbreaks of FMD, they were reported. And this is again the spatial distribution of first quarter of 2016. And in the second quarter, April to June 2016, 356 outbreaks of FMD, they were reported. And this is the spatial distribution. You can see that there is a decline in the number of outbreaks reported. And we understand that successfully the surveillance model, it was implemented, and the field staff, it worked hard to contain the infection wherever there was an outbreak of FMD. Now, based upon the information that was has been shared, we can say that that the surveillance model was well suited for a country like Pakistan, where disease is endemic, and the implementation of the surveillance model significantly improved the FMD outbreaks already reported in the country. And the surveillance model also assisted in determining the disease pattern in the country, as well as to determine what are the hotspots available in Pakistan. And based upon the data that has been generated, a risk-based control strategy was developed, and this strategy has already been approved by the government of Pakistan. And we are confident that very soon that a national program based upon this strategy will be in place in the country. For the implementation of this project activities, we gratefully acknowledge the excellent support that was provided by all the livestock department in the country. And similarly, there was FMD World Reference Lab with the samples submitted. They were subtyped, and vaccine matching studies were carried out, and information was shared with the project. And similarly, the Plum Island Animal Disease Research Center in New York also collaborated and helped us in genotyping and vaccine matching studies. Support of Chief Veterinary Office in Pakistan as well as the National Veterinary Laboratory is also acknowledged, and all stakeholders, particularly livestock farmers, they also supported the project activities very well. And at the end, we acknowledge the financial assistance provided by the USDA to develop this surveillance model and implement in the country. Thank you very much.